All right. Good afternoon, everyone. Thank you for joining us for today's webinar, One Health and Climate-Driven Tick-Borne Diseases, brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. Our webinar series aims to explore current and emerging infectious disease and climate change topics to share knowledge, research, and best practices. My name is Maddie Schuler, Project Officer with CPHA, and I will be the moderator for today's webinar. Before we begin, we want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for a millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. I wanted to take a quick minute to tell everyone about our upcoming Infectious Disease and Climate Change Forum, which is being held virtually November 8th and 9th. This year, our forum aims to engage partners from within and outside the health sector, facilitate education, awareness, and the dissemination of information and tools from across disciplines, as well as highlight different perspectives on and social impacts of climate change and infectious disease on health and well-being. So registration for the forum is now open and offers participants access to 7 sessions over the course of 2 days and the opportunity to virtually connect with speakers and engage with participants. Sessions include dynamic plenaries, oral abstracts, and panel sessions. So to learn more about the forum and how to register, you can visit cpha.ca/infectious disease and climate change forum. And I will also paste this in the webinar chat for those of you who are interested. Just a few quick housekeeping notes before we begin. If you have any questions for our presenter today or technical difficulties, please type them into the Q&A box at the bottom of your screen. And then after the presentation, I will read them out loud and our presenter will have the opportunity to answer them. And we do strongly encourage attendee participation, so we look forward to hearing some of your thoughts and questions today. Secondly, our webinar is being recorded and will be made available on CPHA's YouTube channel a few days after the end of this presentation, and presentation slides will also be circulated. Lastly, we would love to get your feedback, so after the webinar, please fill out our 5-minute survey, which will open automatically in your browser once you close Zoom. And this feedback really helps make these webinars what they are and gives us a better sense of what IDCC topics you would like to learn more about. Now, I would like to introduce our speaker for today's webinar. Dr. Jacqueline Badcock is a veterinarian from the Atlantic Veterinary College. After 6 years of wildlife and small animal clinical practice, she joined the New Brunswick Department of Health to manage the West Nile virus response and corvid surveillance. She has directed the Wildlife Rabies Control Program and been a member of the North American Rabies Management Planning Team. As the Public Health New Brunswick veterinarian, she focuses on the surveillance, prevention, and control of zoonotic and vector-borne diseases based on a One Health approach. She participates on several provincial and federal committees and working groups, including Canada's National Adaptation Strategy. She is interested in climate change and the impacts on public health. And with that, I will turn it over to Dr. Badcock.
First, I'll unmute myself, which would be helpful. And do I have to share my screen, Maddie, to start?
Yes, go for it.
I want to say, of course, I'm just delighted to be here to talk to you today about ticks and climate-driven diseases. I have to say ticks are probably one of my big passions, as well as climate change. So I've been working with the Department of Health for a while as the public health veterinarian. And so I work on zoonotic diseases that are transmitted from animals to people and sometimes vice versa. So the work I deal with has been, of course, like rabies, West Nile, and Lyme disease and other tick-borne diseases that we'll talk about today. I'm going to see if I can make the slides move. Hold on, maybe we won't be talking about anything. There we go. Great. So what are tick-borne diseases? Basically, they're caused by a number of different pathogens, include bacteria, viruses, and parasites. And as you can probably see, they're spread to people and pets through the bites of infected ticks. And in recent years, we've really been seeing an increase in the number of tick-borne diseases in Canada. So Lyme disease, you've probably all heard, it's the most common tick-reported disease both in Canada and the United States. It's caused by a bacteria. We're going to look at Borrelia burgdorferi, sensu stricto, because that's a species that causes most of the Lyme disease cases in North America, but there are several other Borrelia species that can cause illness. Transmission is through the bites of infected ticks, most commonly through the bites of Ixodes scapularis and Ixodes pacificus. Ixodes scapularis is called like the black-legged tick or dare tick, and it's widely distributed throughout eastern US. And in southeastern Canada, we've been seeing the geographic spread of it. So correlating to the spread of Lyme or the Ixodes scapularis ticks, we do find Lyme disease cases are reported through the upper Midwestern and Northeastern states, and then more recently from South Central, Southeastern regions of Canada. Ixodes pacificus ticks, on the other hand, called the Western black-legged tick, is really found in kind of Western Canada and the Western US. So we do see some cases of Lyme disease reported from the Northwestern states and Southwestern regions of Canada. So with Lyme disease, we tend to see clinical symptoms in people develop 3 to 30 days after a tick bite. One of the first symptoms that appear is a rash called erythema migrans. And you can also have like sort of non-specific flu-like illness. If not treated, Lyme disease can progress to sort of disseminated Lyme disease and involve arthritis in the joints or cause severe illness associated with cardiac and neurological complications. Diagnosis is based on clinical symptoms, exposure to vector ticks, and supported through laboratory testing, for example, blood tests. And treatment is with antibiotics. We also see Lyme disease in animals, in dogs and horses. Interestingly enough, most infected dogs actually do not have clinical illness, but potentially around 2 to 5 months after the tick bite, they can present with sort of an intermittent shifting lameness that really responds quite well to antibiotics. But sometimes severe kidney disease can develop and have complications. Horses too may not have any symptoms of infection, but sometimes they can develop with lameness, difficulty standing, and neurological symptoms as well. And treatment is with antibiotics. So here you can see the graph shows the number of cases being reported in Canada from 2009 to 2019. And we really do see the cases of Lyme disease are increasing. The red bars indicate the number of cases that were acquired within Canada. So did not have any history of travel outside of Canada to areas that have Lyme disease. And the map shows in 2020 where Ixodes scapularis ticks that were infected with Borrelia were found in Canada. So we're really kind of sort of seeing that range spread. Anaplasmosis is another tick-borne illness. It's a bacteria. There's lots of different Anaplasma species that can affect pets and livestock, but we're just going to look at Anaplasma phagocytophilum. And again, this is transmitted by both Ixodes scapularis and Ixodes pacificus ticks. Transmission can also occur through blood transfusions and organ transplants, though. So kind of similar to Lyme, we really see the majority of reported cases are in that upper Midwestern, Northeastern states. And sporadic cases have been detected in South Central, Southeastern regions of Canada, but really those numbers have kind of been increasing in recent years. In 2021, I believe there were about 25 cases were detected in Quebec, and in 2022, Nova Scotia identified over 50 cases. So we are starting to see an increase in those as well. Clinical symptoms tend to develop 1 to 2 weeks after a tick bite if they develop at all, because many people are asymptomatic. And anaplasmosis can cause a mild to moderate non-specific flu-like illness, chills, severe headache, muscle aches. Severe illness, though, can develop too, especially in people at higher risk, including like the elderly and people with weakened immune systems. Diagnosis, much like Lyme, is based on clinical signs and symptoms, exposure to ticks, and laboratory testing, for example, blood tests and blood smears. And up in the picture through that little blue arrow, you can actually see a clump of Anaplasma bacteria that are found inside the white blood cells. Finding this on a slide is kind of highly suggestive of anaplasmosis because it's kind of a typical thing that this bacteria does. And treatment is with antibiotics. We also see Anaplasma phagocytophilum in dogs and horses. For both dogs and horses, the clinical symptoms are sort of fever, decreased appetite, and lethargy. And treatment, again, is with antibiotics. Babesiosis as a parasite found in red blood cells. Again, there's lots of different Babesia species, but the one that causes the most cases in human is caused by Babesia microti, although sporadic cases can occur with other species. Similar to what we've been seeing, it's transmitted through the bite of infected ticks, mainly again, Ixodes scapularis. However, transmission can also occur through blood transfusion and organ transplant because this parasite does infect the red blood cells. And it's probably hard to see, but you can see little tiny dots up in the red blood cell in the corner that shows the parasite. Again, similarly to the previous diseases, we're seeing most of the reported cases in the upper Midwestern and Northeastern states. So far in Canada, we've really only kind of detected sporadic cases, but as we've seen the trend and spread of Lyme disease and anaplasmosis, it's probably likely that babesiosis could spread as well. Clinical symptoms in people tend to develop 1 to 4 weeks after a tick bite, could be longer with a blood transfusion. And again, infection can be asymptomatic or a mild nonspecific flu-like illness. Because the Babesia parasites infect the red blood cells, you can also have an anemia. And babesiosis can be life-threatening. And for those people who are at risk for severe illness, including people who don't have a spleen, the elderly, and people with weakened immune systems. Diagnosis is based again on clinical signs and symptoms, exposure and lab testing, and effective treatments for babesiosis are available. Babesia microti actually doesn't seem to cause illness in pets, but again, there's lots of other Babesia species that can. Envirus disease is a virus that can affect people. It doesn't appear to affect pets so far. It's transmitted by Ixodes scapularis ticks, but it can also be transmitted by other tick vectors, including Ixodes cookii, the groundhog tick. So far, really only sporadic cases have been occurring in the northeastern states and Great Lake regions, and it occurs really rarely in Canada. But we can be looking at that with surveillance. Some provinces have Powassan virus under surveillance and some don't. Clinical symptoms in people, again, tend to develop 1 to 4 weeks after the tick bite. And infection, again, can be asymptomatic or mild nonspecific flu-like illness, but it can also be a severe life-threatening illness as encephalitis and meningoencephalitis can develop. Once again, diagnosis is based on clinical signs and symptoms, exposure to ticks, and laboratory testing. So we're seeing an expanding range of vector ticks northward due to climate warming. We have migratory animals that are helping to spread ticks. And there's also land use changes, including land fragmentation. And all of this has increased our risk of tick-borne diseases. So in Canada, we have over about 40 species of ticks, but there's really only a few that are competent vectors and able to transmit pathogens like the bacteria to animal hosts and help maintain the pathogen throughout their life cycle. Ixodes scapularis and Ixodes pacificus can both transmit the diseases we saw, including Lyme disease. And as indicated, we kind of have Ixodes scapularis in the eastern part. The maps show the US range distribution of ticks, so it seems likely that spread northward into Canada, you can kind of see right where it's going. And the same as Ixodes scapularis in the west. Ticks themselves have very complex life cycles that probably last over 2 years. And during which they'll pass through larva, nymph, and adult, and we're just going to look at those in a little more detail. So we can say tick eggs are typically laid in the spring, and depending on the temperature, the eggs hatch over the next several weeks into larval ticks. So larval ticks are really small. You can see the one on the thumb. They're probably about 1 millimeter or less, and they have 6 legs. When they emerge, they start looking for a blood meal from any suitable host, and typically they feed from small rodents like mice and shrews. It's during this feeding that the larval ticks can become infected with Borrelia burgdorferi or perhaps another pathogen. So after feeding for a couple of days and having a good meal, the tick detaches, looks for a nice sheltered spot on the ground, and begins the process of molting into the next stage. And molting is influenced in part by the feeding success of the larval tick, but also by temperatures. You kind of really need warmer temperatures to successfully molt and emerge into the 8-legged nymph. So nymphs themselves usually do not feed right away because they often emerge like late summer, early fall. So instead, they'll become dormant during winter. They'll sort of burrow down in the leaf litter and kind of enter a state of minimal metabolic activity. It helps protect them against freezing and months without feeding, but doesn't mean they don't stay dormant for long. In spring, they'll emerge and they'll start questing and looking for a blood meal. So ticks really can't fly or jump. So Ixodes scapularis do something sort of unique. They'll kind of climb to the top of vegetation, holding on with their lower legs. And with their upper legs, they'll leave them outstretched. And they're really just waiting for a warm body to kind of pass by, in which case they're able to drop on the host, crawl around, and find a place to feed. Again, nymphs often feed just on small rodents like mice, chipmunks, squirrels, but they'll feed on larger wildlife like raccoons and deer, and they will happily feed and attach on people and pets. So on-fed nymphs, as you can see, are quite small. They're still about 1 to 2 millimeters in size, probably like the size of a poppy seed. But after feeding, they'll become kind of larger over several days. And once again, during this feeding period, the nymphs themselves can either become infected with Borrelia burgdorferi or another pathogen, but also this is where they can initially transmit Borrelia burgdorferi or another pathogen to the host. Again, much like the larval, once the nymph has finished feeding, they'll drop off, move down into a shelter environment, and begin molting to the next stage. And they will molt into either an 8-legged female or an 8-legged male. So the adults come out in the fall and they're pretty active and pretty hungry. They are like looking for a meal and they start questing right away. So adult female ticks typically feed on larger wildlife, but again, they'll also feed on people and pets. And the males usually do not feed because they're just looking for the females. Unfed adult female ticks are about 3 to 4 millimeters, so a little bit bigger than nymphs, probably about the size of a sesame seed. But once they've attached and fed for a couple of days, they can become quite large and can in fact probably reach the size of a small grape when fully fed. Again, it's during this feeding time that female ticks can transmit Borrelia burgdorferi or potentially another pathogen to their host. They could become infected with another pathogen, but because they die after laying their eggs, they only take one blood meal. There probably is not going to be transmitting that to anyone else. So similar to nymphs, when the fall is done, the adults can become dormant through the winter. And then once it warms up in the spring, they'll become active and start laying eggs. And that sort of continues back the whole life cycle. We can also kind of look at the life cycle of the pathogen itself, or the Borrelia bacteria, because they also have really complex life cycles sort of outside of the ticks. So what we see with Borrelia is it typically circulates between Ixodes ticks that transmit it to kind of a reservoir host species. And the reservoir host species don't seem to become ill. They just seem to be fine carrying Borrelia. And it really helps maintain it back and forth and circulating in the environment. So from the pathogens, bacteria's viewpoint, this is great because I just keep reproducing. But sometimes because ticks aren't really specific feeders, they're generalist feeders and will feed on a lot of different animals. Sometimes they'll feed on what is called a dead-end host. And this is sort of dead-end host from the bacteria's viewpoint. And that can be people and pets and stuff. And basically dead-end hosts can become ill with infection, and they do not help maintain the bacteria within the population. So we start looking at climate change and rising temperatures, and overall, this has really improved conditions for tick survival. Really, those warmer temperatures have we seen mean ticks can develop through their life stages faster. They can molt faster. They may not have to go dormant over winter. They might be able to move to the next stage right away. And because of all these improved tick reproduction and survival, in areas where ticks are already established, we're actually kind of seeing an increase in the abundance or in the number of ticks in the area. So perhaps instead of encountering one tick during your walk, you might now be encountering a dozen. The warmer temperatures are also meaning that ticks are becoming active earlier in spring and potentially staying active later into the fall. So we have, questing activities of the ticks is going on for longer. We have seen climate change cause, a geographical range expansion of Ixodes scapularis ticks northward. So we now see ticks in locations where they were not there 20 years ago. So with these warmer temperatures, not only are they expanding northward, we might also see ticks being able to move to higher elevations. So there could be kind of a range expansion within existing ranges. And also climate change and increasing temperatures could also affect the pathogen life cycle. Potentially the reservoir hosts themselves could have changes in their geographical ranges and their abundance and seasonal activity, or potentially an entirely new species could move into an area and be an opportunity to become a reservoir host for that pathogen. So we've got ticks are active and our tick season is starting early, but you know what? People and pets are also out there enjoying the warmer weather earlier. Ticks probably start questing and looking for a host when we have temperatures above, 4 to 10 degrees Celsius. And so people and pets are also out there longer during these lovely temperatures. What this is meaning is that really we're having an increase in an exposure to tick habitats. And this combined with sort of our increase in tick activity or longer season, we're getting an increased likelihood of tick exposure. So basically we've got more ticks, more places, more opportunities for exposure. And we're seeing, similar to the increasing number of cases of Lyme disease, we may also see that with other tick-borne diseases, including Babesiosis and potentially Powassan virus. But the northward range expansion that we've seen with Ixodes scapularis potentially could occur with other tick species and introduce new pathogens into Canada. The Lone Star tick is distributed in the eastern United States, and this tick can transmit several different pathogens, including southern tick-associated rash illness, human ehrlichiosis, and then the condition called alpha-gal syndrome, where people develop an allergy to red meat. So potentially this tick species could move northward. The Rocky Mountain wood tick, located on our western coast too, transmits Rocky Mountain spotted fever and Colorado tick fever, and there's a potential that again we could see a range expansion of this tick species. So how do we effectively respond to and prevent tick-borne illness, where we've got such complex interactions between people, pets, ticks, and their shared environment? Human and animal disease surveillance and looking at cases can provide an indication of where the disease was likely acquired, but that alone is probably not a good predictor of risk and where it could be required. Further to that, not all diseases are nationally reportable, and reporting requirements do vary among provinces and territories. Lyme disease is nationally reportable, and currently work is underway to include Anaplasmosis and Powassan virus in national reporting. Tick surveillance too, looking where ticks are, can help provide an indication of their geographic distribution. And if we combine that with pathogen testing, that could provide a good indication of risk, but this really requires extensive resources. So One Health recognizes the interconnection between people, animals, plants, and our shared environment. Really, the health of people, we're so closely connected to the health of animals, both wildlife and domestic, and our shared environment. Tick-borne diseases and other challenges that occur at sort of this intersection of human, animal, and environmental health are really complex problems. And One Health is a collaborative, multi-sectoral, and transdisciplinary approach to achieve optimal health outcomes. No one organization or sector alone can really address the complexity of these issues. So One Health promotes collaboration and cooperation, not just amongst government departments and agencies, but amongst non-governmental organizations and relevant stakeholders. This means, experts can be working together across disciplines, so including, doctors, nurses, public health practitioners, epidemiologists, veterinarians, entomologists, ecologists, and wildlife experts, all sharing their areas of expertise in a collaborative approach. Southern New Brunswick has had and established Ixodes scapularis tick populations for quite a while. And in areas that are highly endemic for Lyme disease, a single dose of antibiotic can be used as prophylaxis to help reduce the risk of acquiring Lyme disease after a high-risk tick bite. clinical practice guidelines really recommend for Lyme disease prophylaxis to have an identification of the tick species, the life stage, how long it's been attached, and really what the local rates of infection are, or the endemicity of Lyme disease in the area. This was identified as a gap within New Brunswick. So to help address this gap and support healthcare practitioners' assessment of risk bites, we put in a proposal to the Infectious Diseases and Climate Change Fund. And it was, excuse me, and it was accepted, which was great because this allowed then our big One Health collaboration. So we've had in New Brunswick lots of great collaboration on our tick surveillance between Public Health New Brunswick, the Provincial Veterinary Laboratory, working with the National Microbiology Laboratory, and researchers like the University of New Brunswick. So really building on this, our project right from the get-go was kind of built on a One Health. So we have government agencies with Public Health New Brunswick, our regional health authorities, our provincial veterinary laboratory, the National Microbiology Laboratories involved, and we had non-government organizations too, with the University of New Brunswick and the NB Medical Society, the New Brunswick Veterinary Medical Association. And I think the success really of this project really depended on this approach that relied on the expertise from several disciplines that kind of came together and was provided by our project collaborators and partners. So what we did was we had just an overview. So we recognized that tick-borne disease was increasing, and in order to implement Lyme disease prophylaxis, we needed to provide some good information to physicians and assess in their risk. Excuse me. So we really wanted to build their capacity to respond. So we had a collaborative laboratory network. We looked at tick surveillance and monitoring and had communication strategies. And the outcomes of our project, again, was we have a One Health tick diagnostic service. We have One Health tick surveillance and pathogen testing, communications with partners that include the risk areas and tracking of tick bites, and ongoing communication strategies. So our collaborative network is basically our 6 regional hospital diagnostic laboratories working with our veterinarian diagnostic laboratory, so our provincial veterinary laboratory. And the goal really was to support healthcare practitioners in their clinical management of patients following a high-risk tick bite by providing a tick diagnostic service. And this was like a really great motivating goal that everyone was like agreeing with and felt it was, worthwhile working on, which is kind of quite nice and motivating. So we basically ended up with stereo microscopes that could take high quality images of ticks that were used for tick identification. So our expertise within our vet lab helped provide training on tick identification to all the hospital labs, and not just for Ixodes scapularis ticks, but for all of our tick species that we see in New Brunswick. And those initial skills were able to be built on and further enhanced because if there was a tick that they weren't sure about, they were able to share the image among all the labs and with the experts at the vet lab. So that kind of really helped to improve and increase their expertise. Our network had really good communications. We had regular meetings, emails, and impromptu meetings to discuss issues that arose. And so that was quite helpful. It was also really helpful to have like a single identified support for the network. They kind of provided the agenda, helped organize meetings, took the minutes, and so on. Because when you're collaborating with experts, like on such a project, it often means that this project may not be their main job. So being able to support them in any way possible so that we're able to gain their collaboration and input, but without having them to take up so much time doing it was really good. And so from the tick training, they developed several tools that help support the tick diagnostic service. Each tool really had a clear timeline and deliverable, and amongst the collaborative networks, kind of a lead was assigned to each tool. So it was sort of spread out as well, which helped. So the tools that they did develop was like tick identification guide, a standard operating procedure for the labs. The network also looked at data variables that we would need, both for kind of a broader tick surveillance, like what are we seeing in our tick populations that are coming into the lab. And the 6 labs in the vet hospital kind of work together, standardize both the requisition forms, like what's asked of physicians and veterinarians when they fill it out, as well as creating kind of a standardized report that can be sent back to physicians and back to veterinarians. And I guess for some areas, like our hospitals don't typically work together. They're sort of, separate within. But one of the great learning experiences from COVID-19 was being able to share data and look collectively at data was really important. And so we were able to apply this approach to this project as well. We did have active tick surveillance that went with the project too, provided by the University of New Brunswick. So we did active sampling throughout southern New Brunswick. And active sampling is basically walking around with dragging a piece of white cloth behind you. You're in areas that you hope have ticks, and you're just sort of hoping that the tick's going to fall onto the cloth. After walking a bit, you just check your cloth for ticks. And you can see how this is the part that's really labor intensive, right? I have to admit, I get pretty excited about finding ticks on the drag cloth. And honestly, I expect everyone else to be just excited, but sometimes they're just not. So we take all the ticks that we do collect and we send them to the provincial veterinary laboratory, and they get tested for Borrelia burgdorferi and other pathogens. And sometimes this is done in collaboration with the National Microbiology Lab. And all of this helps determine the local rate of infectivity of ticks with Borrelia burgdorferi, which again is another piece of information that feeds back to the tick diagnostic report that's sent to physicians and veterinarians. So our diagnostic service is province-wide. And what they look at is kind of the criteria that meets for the tick assessment of high-risk tick bites. So they're able to identify the tick species, determine the life stage, determine the degree of engorgement or how long the tick has been feeding, and then provide an estimated length of attachment time, as well as including the local rate of infection in the reports. We kind of have morphed, so we no longer do active surveillance because the project has actually ended. But we have kind of morphed into sort of a One Health tick surveillance and pathogen testing thing. So with the collaboration of the hospitals and with our provincial veterinary lab, we kind of have created an ongoing sustaining submission of ticks, because every year the hospitals can send all their ticks to the veterinary lab for testing. In addition to using the tick diagnostic service, though, we're also able to link in with other collaborators. For example, the Canadian Lyme Disease Research Network that does some active surveillance in New Brunswick, and we can kind of share the data back and forth. We also kind of look at the data we have and sort of see, are there gaps where we're not getting enough ticks or we don't have any tick submissions? And we're able then to still go out and do some active surveillance to help kind of fill in those gaps. So that's sort of where we are now with our tick surveillance. Based on this approach too, we've kind of modeled a One Health risk area. So we're really using a number of different data sources that come together to help inform the risk of where ticks and Lyme disease potentially are. So we look at human cases of Lyme disease, we look at animal surveillance data, we again look at our One Health tick surveillance data, which is ticks from peoples and pets that come into the tick diagnostic service. We look at our active tick surveillance and our pathogen testing, and we consider additional areas where tick surveillance occurs, like both through eTick, Citizen Science, and again, our Canadian Lyme Disease Research Network. And this can again help identify the emerging areas of risk and where it's occurring in New Brunswick. We've also started work on identifying a tick bite tracker, like where tick bites are currently occurring. This is under development, and it's really going to be a web-based dashboard to help represent the risk of Lyme disease and tick bites. And again, it is a One Health model, because we're using the ticks that come into the diagnostic service, again, from our hospital labs and our vet labs, to look at what kind of tick species are we seeing, how many are coming in, when are they active, like when are we seeing that period of seasonal activity. But in addition, the tick bite tracker will be looking at the number of doxycycline single dose given to people, which would indicate that they've had Lyme disease prophylaxis. And so that information can help model both where people are being bitten by ticks or high-risk tick bites, and also indicate who potentially is at the greatest risk of tick bites from age and gender. So we're looking forward to that going live. And then our partnerships. Partnerships were key in communication strategies, for sure, but also under a One Health approach, having different disciplines really helped identify new opportunities and new partnerships that have occurred that wouldn't have happened without that approach, for example, with the New Brunswick Pharmacy Association. So we did partner with New Brunswick Medical Society. They have a communication strategy for healthcare practitioners that will help build their knowledge and awareness of climate change and Lyme disease. They've created some great pamphlets on Lyme disease, as you can see there, in sort of 4 languages, both French, English, Wolastoqey, and Mi'kmaq. And we're also working on a New Brunswick Tick-Borne Diseases Reference Manual for physicians with infectious disease physicians and medical officers of health that will really help provide them with evidence-based information and tools that will help support them in their diagnostic and therapeutic when their modalities in looking at tick-borne illness. And that work is kind of ongoing. So that's been a great piece and partnership. Similar, we've also done same partnership with the New Brunswick Veterinary Medical Association. Again, they're getting the reports from the Tick Diagnostic Service. And we are working again on a veterinary manual because, as we've seen, tick-borne illnesses affect both people and pets, and hoping to continue to raise awareness on them and the health risks associated with tick-borne illness. And the New Brunswick Pharmacists Association was kind of a new link that came up because of having different disciplines, but only recently, I think just in May 2023 in New Brunswick, pharmacists can provide Lyme disease prophylaxis for people living in that higher area at-risk communities with established populations of Ixodes scapularis. This helps relieve the burden on physicians and stuff too, and I think this is going to be a great partnership moving forward. So really, as we see, we've got lots of interconnection between people and animals and stuff, and we are connected to them, but we do have to be aware, and we have to be able to prevent tick bites and be tick smart. So our strategy, probably like lots of other provinces, again, have still focused on preventing tick bites. So, protecting yourself, checking for ticks, removing ticks safely, and act if you have symptoms of tick-borne illness. So we'll just briefly kind of look at those. These are probably quite similar, but it might make now a bit more sense about why we say walk in the middle of trails to help avoid brushing up against the vegetation and ticks. Use, Health Canada approved insect repellents like DEET. There's also clothing treated with permethrin that can help repel ticks. And you can also cover up the tick, keep ticks off your body. Certainly when we're in the field tick dragging, we've got our pants are tucked into our socks and so on. And there's also tick control products that are available for pets that you can talk to your veterinarian with. That's an apple seed there in the photograph, so it just gives you an indication of what the sizes of ticks are. Checking for ticks, really important to check for ticks, especially if you've been in areas where there have been black-legged ticks. It's sometimes they crawl on you and you don't feel them crawling at all. And they do tend to like to go to places that are sort of dark and with hair behind the ears. And so it's sometimes helpful to have someone help you looking in those places to find those ticks. Early removal of tick will help prevent transmission of Borrelia burgdorferi. So daily tick checks are important. You can also check your pets too. They can get ticks often behind their ears, under their collar, between their front and back legs, and around their toes and tail. Removing ticks safely can be done. There's lots of different tick remover applications, like tick twisters and stuff. You can also use a fine tip tweezers. You want to grasp as close to the skin and the tick's head as possible and pull up. If ticks have just attached, they'll often come out quite readily. But if they've been attached for a while, it could be a little harder to sort of pull them out. So just pull with a steady upward pressure and then watch the site of attachment. And if you are bitten by a tick, to be aware, certainly now, if you have an attached tick, but you don't have any symptoms, you can either contact your family physician or your local pharmacist for an assessment of a high-risk tick bite and potentially receive Lyme disease prophylaxis. That does have to be provided within 72 hours of removing the tick, so it's a bit timely. So if you miss that window and you've had a tick bite, then you can just watch for the early symptoms of Lyme disease, a red circular rash that gets bigger or flu-like illness. And if that happens, then you can go see your family physician. Landscaping has kind of become a new thing too, like making your yards tick-free. Ticks can dry out with the sun. They kind of need to be sheltered, so they really don't like mown grass. So landscaping can help create areas that are more like tick unfriendly or tick safe. For example, moving playgrounds in the middle of mown lawns, and sometimes placing borders and stuff too can help prevent areas that ticks won't want to crawl across. So there's different work going on with that too. So there, I think that brings the end of the presentation. So I'm happy to take any questions.
Thank you so much, Dr. Badcock. That was wonderful. So yes, at this point, if you do have any questions, please feel free to submit them in the Q&A box at the bottom of your screen. And I do think there's already some wonderful questions coming through. First question, can cats also contract anaplasmosis?
Um, yeah, phagocytophilum. You know what? I'm going blank on that. I'm not actually recalling if they can, and I'd have to look back, but I don't. They probably can, but I couldn't say for sure.
No
Sorry
problem.
about that.
Next question. How are SDGs? I believe this refers to Sustainable Development Goals. Please correct me if I'm wrong. But how do Sustainable Development Goals, how are they correlated with a One Health concept?
Oh, that's a really, really great question. And I think it's in part, they can integrate very well, for sure, because it's, again, by looking more broadly at things, you probably are incorporating things that you may not have thought of, but by including other disciplines, so sustainability could become part of it. So I think that's a fantastic question and a good way of looking forward at things.
Definitely. Thank you. Where do male ticks get their nutrition if not from feeding?
Apparently, it seems they just hatch and just start looking for the females. and then they probably die that fall. They don't overwinter. I guess they're just driven by other conditions.
Interesting. Thank you. I believe you touched on this briefly, but is there a risk of tick bites in an urban setting in one's backyard garden, or is the risk only when hiking?
No, that's a really great question. And when you look at tick habitats, like although our map sort of shows broadly, say this is the risk of ticks, when you get down to kind of like small microclimates and microhabitats, you indeed easily can have ticks within an urban setting. For example, parks, any place where there's like habitat that they can survive. They just don't like the big wide mowed spaces. So if you are in an area that has endemic tick populations, your backyard could indeed be a place where you would contract ticks, or go into your local park. If you stayed on your paved areas, you're probably safe, but that's maybe not the best thing for your health either.
Right. Yeah. We have lots of thank yous and wonderful presentations. Again, if you have any questions, please feel free to type them into the box. I do have a question because I know One Health is something that we're increasingly talking about, but for some organizations or units still kind of on the horizon or not frequently talked about. Do you have any advice for public health units or other organizations, departments that are looking to operationalize or incorporate One Health into their work?
Yeah, it's really intriguing. So for the zoonotic world, we've often worked in One Health because
Hmm.
that's how we have rabies comes from wildlife to people, Lyme disease, and so on. But you're right, for a lot of human disease, traditionally, we are just looking at human cases. So I guess a good connect could be initially for public health people, like talk to your CD people who are potentially working on zoonotic diseases, see where those connects are. I know we've started up a informal One Health kind of get together between agriculture, natural resources, environment and local government, and health. And we probably have met, every 3 to 4 months. And it's really just a way of like, hi, this is what I'm seeing. What are you seeing? And we can sometimes through that have identified like, oh, this is an area I can help you out on. Or I didn't even know you guys were doing that. So kind of creating those relationships even prior to. is useful. So when you do get the COVID-19 in the deer, you've actually got, a network that you've established and worked with.
Yeah. Yeah, that's so true. Wonderful. A couple more questions coming in. Is or was there an evaluation done of this project, or is one planned?
Um, uh, Not official. Like I know the Infectious Diseases Fund does have a very strict evaluation criteria and stuff, but we didn't use that because we were under a different model. We were a grant as opposed to a fund. So in terms of evaluating, we have done kind of an evaluation of our tick identification service in itself and how that's doing. In terms of correct identification and so on. But I think the broader picture will be how does this relate, now and moving forward as we become more used to tick-borne diseases, perhaps we're less likely to submit them. We're using more prophylaxis. And so I think it's going to be a matter of combining that with looking at how is our Lyme disease cases going, how's our awareness, and really overall, how is our public and our healthcare professionals, responding to tick-borne diseases because they're not going away. And the big focus then being on prevention and early intervention.
Mm-hmm. Mm-hmm. Hi, Dr. Badcock. It's a very interesting presentation. I am from India and I work in public health communications. I'm interested in knowing more about what the communication collaterals are for creating awareness.
Oh,
Like,
if I had that answer, we would have everything solved. I think on communications, you've seen everything. It's a multimodal approach. And again, that's where a transdisciplinary approach occurs. Like, can you work through your schools, the target audiences, working with, direct people that have links with those partnerships you want, like your healthcare professionals, your veterinarians, your public. But they can come up with some really good stuff. But yeah, communications and raising awareness and creating those behavioral changes of checking for ticks are definitely, huge challenges. And I don't think
mhm.
there's any one single thing that's been successful.
Yeah, lots of different media channels or mediums to kind of do that. And
Yeah.
so great question. Um, did you have any challenges that came up, when doing this project?
Um, yeah, I think there's probably like lots of you mean specific to comms, Maddie, or in general?
Just in general.
Yeah, I think there's probably lots of different challenges. I think the one that part was because we had a prior existing relationship with the vet lab and with the university because we had done other tick surveillance stuff. So
Hmm.
again, having those networks there. So when the challenge did approach, it was often a matter of like talking about it and how do we move forward and how do we pivot and change. Like for example, with the pharmacist coming in on that, we didn't know about that when we initially put in the project and did for a tick diagnostic service. But it was still kind of like, oh, okay, how can this group help support that work and help rise? So it's probably a matter of open communication, open to ideas, and looking at, again, what science says and the best path forward, which sometimes is kind of different than what you thought it was before you had the conversations.
Right. Yeah. And that circles back to, again, sitting down at those tables and having those conversations with different people and making those partnerships. So thank you. As there are no more questions, I believe that brings us to the end of our webinar today. Again, I want to thank you so much, Dr. Badcock, for joining us and everyone else for joining us today. We do have some more wonderful webinars in our fall series coming up. The next one is on Tuesday, October 10th, titled The Role of Climate Change in the Spread of Vectors and Vector-Borne Diseases in Windsor, Essex County. So we hope to see everyone there. Thank you so much and have a wonderful afternoon. Take care.